In the last class, we have seen various bones of cranium, and we also have seen the introduction about vertebral column. Now, in this class, we will see the characteristic features of individual vertebrae. We have seen that there are different types of vertebrae: the cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum, and coccyx. And these individual vertebrae will have their own structural characteristics and can be differed from each other. Let's start with cervical vertebrae. Cervical vertebrae are the smallest vertebrae when compared to thoracic and lumbar vertebrae. And we have seen that there are 7 cervical vertebrae. And all these cervical vertebrae have certain common characteristic features. Let's see the characteristic features of a cervical vertebrae. The cervical vertebrae will have small body when compared to the other vertebrae, and the cervical vertebrae's transverse process will also have a foramen which allows the passage of vertebral artery, whereas the transverse process of thoracic vertebrae and lumbar vertebrae do not have any foramen. And the spinous process of cervical vertebrae is bifid, and only the 7th cervical vertebrae's spinous process is prominent and gives attachment to the muscles of neck. These are the common characteristics of a cervical vertebrae. But the first and second cervical vertebrae, that is atlas and axis, these have features which are different from that of other cervical vertebrae. Now, let's see the features of atlas. Atlas is the first cervical vertebrae and also the first vertebrae of the vertebral column. Atlas does not have any body which can be distinct, and also the spinous process also is not distinct in the atlas, whereas it has the transverse process with a foramen. And this atlas has 2 flattened facets which are necessary for formation of articulation with the condyles of occipital bone, and this condyloid joint gives nodding movement of the head. The second cervical vertebrae is axis, and this axis is having a small body with some superior protrusion which is called as odontoid process. The odontoid process, it occupies the body foramen of atlas, and they are fastened with each other by a transverse ligament. And this attachment of atlas and axis, it gives the sidewise movement of the head because it forms the pivot joint. Now let's see the characteristics of thoracic vertebrae. We have seen after the cervical vertebrae comes the thoracic vertebrae, and there are 12 thoracic vertebrae, and as the vertebrae moves from T1 to T12, the size of this vertebrae also increases, especially the body of this vertebrae increases because this vertebrae have to bear the weight of the upper regions of the body. And all the typical characteristics of a vertebrae which we have seen previously are visible for this thoracic vertebrae. We have seen that it has a body and it has a vertebral arc. The body is flattened, the vertebral arc has transverse process, spinous process, and vertebral foramen. And this vertebrae also have articulating surfaces, means both the body and also the transverse process will have facets for articulation with the ribs. Since the ribs are attached to the thoracic vertebrae, they should have a region for attachment, and this region for attachment is nothing but the facets of body and transverse process. The other type of vertebrae are lumbar vertebrae, and this lumbar vertebrae are much larger when compared to thoracic vertebrae, and they have wider body because this also is necessary for maintaining the weight of the upper parts of the body. And lumbar vertebrae will have a prominent and elongated spinous process because this also gives attachment to the muscles of the back. After the lumbar vertebrae comes the sacrum. Sacrum is formed by a fusion of 5 rudimentary vertebrae, and this gives a triangle shaped wedge structure. And the superior of this sacrum is flattened, which gives attachment to the body of the 5th lumbar vertebrae, and there are foramina on either sides of these sacral vertebrae through which the spinal nerves leave the vertebral column. Laterally, the sacrum also forms a joint with the innominate bone, that is, the ilium portion of the innominate bone, leading to formation of sacroiliac joint. And inferiorly, the sacrum gives attachment to the coccyx. Coccyx is once again formed by fusion of 4 small vertebrae, which forms the terminal portion of the vertebral column. These are the characteristics of individual vertebrae. Now, let's see about the other features of vertebral column. In this, we will be discussing about intervertebral discs, intervertebral foramina, ligaments of vertebral column, various curvatures of vertebral column, movements of vertebral column, and functions of vertebral column. First, we will start with intervertebral discs. We have seen that these vertebrae are arranged together as a pile of stacks, and the bodies of individual vertebrae will have intervertebral discs between them. This intervertebral disc is a fibrocartilage, and which has a tough outer rim made up of fibrocartilage, which is called as annulus fibrosus, with a central core of gelatinous material, which is called as nucleus pulposus. And this intervertebral disc is thinnest in the cervical vertebrae and is thickest in the lumbar vertebrae. The intervertebral disc is necessary to form a cartilaginous joint between these vertebrae, and this cartilaginous joint will allow the movement of the vertebral column. Apart from this, this intervertebral disc also acts as shock absorbers and protect from the damage of brain. Next, we will see about intervertebral foramina. So we have seen that when 2 vertebrae are stacked with each other, there are gaps between the pedicles of individual vertebrae, and through these pedicles comes the spinal nerves, blood vessels, and lymph vessels, and hence these gaps are called as intervertebral foramina, and these are present throughout the vertebrae from cervical vertebrae till thoracic and lumbar vertebrae. Next, we will see what are the various ligaments which are attached to the vertebral column and which hold these vertebrae in position. We have seen that there is a transverse ligament which holds the atlas with that of axis. In the same way, there is an anterior longitudinal ligament which is present anterior to the bodies and which extends from the cervical vertebrae to the lumbar vertebrae, and there is an posterior longitudinal ligament which is present within the vertebral canal, and this gives attachment to the vertebrae from the cervical vertebrae to the lumbar vertebrae. And there are other ligaments called as ligamenta flava which gives attachment to the pedicles of individual vertebrae, and supraspinous ligament which extends from cervical to the lumbar vertebrae runs over the spinous process, and this gives attachment to the spinous process, and all these ligaments will hold the individual vertebrae in place so that they are not displaced from each other. When coming to the curvatures of vertebral column, there are two primary curvatures and two secondary curvatures. The primary curvatures are the thoracic curvature and the sacral curvature, whereas the secondary curvatures are cervical curvature and lumbar curvature. When coming to the movements of vertebrae, we have seen that these vertebrae are attached with each other with intermediate intervertebral discs which forms cartilaginous joints, and this facilitates slight movements within the vertebrae. And the various movements which are possible with the vertebrae of vertebral column are flexion, that is bending forward, extension, that is bending backward, lateral flexion, that is bending sidewards, and rotation. So these are the movements that are possible with the vertebrae. Now let's see the functions of this vertebral column. We have seen all these vertebrae, they are necessary for maintaining the weight of the body, and this is possible with increase in size of the vertebrae from the cervical vertebrae to the lumbar vertebrae. And there is a vertebral canal through which the spinal cord runs from the brain into the vertebral column. There is an intervertebral foramina through which the spinal nerves enter or leave the spinal cord, and the blood vessels and lymph vessels enter or leave the vertebral canal. This vertebral column gives support to the skull, and also it forms the axis of the body to which all the other structures are attached to. For example, the shoulder girdle or the pelvic girdle and the limbs, the thoracic bones are attached to this vertebral column. This is regarding the vertebrae and the characteristic features of vertebral column. Now let's see about the other bones of head-cell skeleton, that is thoracic cage. This thoracic cage consists of one sternum and 12 pairs of ribs. The sternum is a flat bone which can be felt under the skin in front of the chest, just in the middle of the chest. And this sternum has three regions: the manubrium, body, and xiphoid process. The manubrium is the one which gives attachment to two pairs of ribs, whereas all the other ribs are attached to the body of sternum. Whereas the xiphoid process, which is present below the sternum, it gives attachment to the muscles of abdominal wall, muscles of diaphragm, and also the linea alba. And the other bones of thoracic cage are ribs. There are 12 pairs of ribs, and we have seen that these 12 pairs of ribs are attached posteriorly to the 12 thoracic vertebrae. The sternum, ribs, and thoracic vertebrae together constitute the thoracic cage. And this ribs are attached anteriorly with the sternum through costal cartilage, and this quantity of cartilage that is present will facilitate the movement of the rib cage during the time of inhalation and exhalation. And each rib will form 3 joints with the vertebrae. That is, the head of the rib, it forms a joint with 2 adjacent facets of the vertebral bodies, and each vertebrae also will form a joint with the transverse process of vertebrae. The first pair of rib is firmly attached to that of sternum, and this is non-movable, whereas the second pair of rib also is attached to the sternum, especially the manubrium, and the 7 pairs of ribs which are directly attached to the sternum are called as true ribs, whereas 3 pairs of ribs which are attached to the sternum but not directly are called as false ribs, whereas 2 pairs of ribs have only attachment with the top vertebrae and they are not attached anteriorly to the sternum, and these are called as floating ribs. We have 7 pairs of true ribs, 3 pairs of false ribs and 2 pairs of floating ribs. And we have seen that the first rib is permanently fixed and there are intercostal muscles that are present between the individual ribs, and these intercostal muscles will pull the rib cage towards posteriorly and superiorly towards the first rib during the time of inhalation. Apart from giving attachment to the first pair of rib permanently, sternum also gives attachment to the clavicle, forming a sternoclavicular joint, and this is regarding the thoracic cage. With this, we have completed with the bones of axial skeleton. Under this, we have seen bones of cranium, which includes bones of skull, which includes bones of cranium, bones of face. We have seen the vertebrae, and we have seen the thoracic cage. Next, we will see the bones of appendicular skeleton in the next class.